Okay, Assalamualaikum warahmatullahi wabarakatuh and very good evening. Welcome to IAIS Forum. Tonight we're going to discuss on the topic the Emergency Ordinance Essential Powers 2021, multiple perspectives on health, economy and politics. We are very indeed and delighted to have four panelists, very distinguished panelists. We have Prof. Dr. Ni Ahmad Kamal Nik Mahmud from the Department of Civil Law, Ahmad Ibrahim Kuliah of Laws, International Islamic University of Malaysia, Professor Datuk Dr. Adiba Kamrul Zaman, who's a former dean from the Faculty of Medicine, University of Malaya, and now he is heading the Infectious Disease Unit. Datuk Dr. Medin Burma, Commissioner, Human Rights Commission of Malaysia, Suhakam. And last but not least, Professor Dr. Muhammad Azizuddin Muhammad Sani, School of International Studies, University Utara, Malaysia. Ladies and gentlemen, the recent proclamation of emergency by the di-Pertuan Agong cited grave concerns on national security, economic life and public order resulting from the COVID-19 pandemic. Officially termed as the Emergency Essential Powers Ordinance 2021, the Federal Constitution grants temporary special powers to the Agong in various areas, including the authority to take over private hospitals, allocate state resources, as well as deploy additional military and police. Public reception to the proclamation, however, is mixed. Primary concerns revolve around the triumvirate of health, economy, and politics. Questions arise on the effectiveness on emergency compared to current movement control orders or MCO, and how it affects current policies aiming to strike a balance between health and the economy. In terms of politics, the ordinance has removed the possibility of having a general election up until August, sparking polarized debates on the merits of maintaining the present government or replacing it, especially in the overall fight against COVID-19. Under this backdrop, this forum features an array of expert panelists with diverse backgrounds. Okay, Prof. Nik Kamal, maybe we can start first with you. So we have 3 rounds. So we have the first round, followed by second, and perhaps in the middle, if we have this second round, we open the questions to the public. Otherwise, we will continue with the panelists, and then we will come back to the public with the Q&A. Okay, Prof. Nik, perhaps you can answer this question. The Emergency Ordinance Essential Powers 2021 contains several interesting provisions. Can you elaborate further on the ordinance, including several general highlights? Over to you, Prof. Nik.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Thank you very much, Dr. Azam. Thank you for inviting me to this very interesting forum, and I would like to welcome also members of the panels. Indeed, it's a thing that is so hot today. I mean, in the sense that there's so many discussion, debates, online, virtuals, and all kind of debates in the newspaper, in forum, and so on and so forth about the emergency. So I think there's no need to speak about emergency because the discussion is always about whether whether the emergency is appropriate or not in the light of the circumstances now. Why countries elsewhere which also have the same problem with us are not declaring emergency, even if emergency is declared in some countries. People have been raising this question: why Parliament is not sitting and kind of thing, right? Rather than going into that, of course, there will be other forums as well who are discussing on these issues. But going to your question, Dr. Azam, regarding the Emergency Essential Powers Ordinance 2021, in the light of the emergency declared recently, so the Constitution gives the power to the Yang Agong to pass law that is called ordinance. Law during emergency is called ordinance. Since if Parliament is not sitting together, then the Yang Agong, the executive, has the power to make this ordinance. This ordinance was passed recently, and what are some of the interesting features about the ordinance is that it deals with the specific issue of the pandemic itself. First and foremost, it provides for an independent special committee, which is to be established. I think the structure of the committee, we can see from the announcement, there are people who have already been assigned or being appointed to that committee, except that we have heard about debate about whether the opposition will be willing to join and and take part in the committee. I think the idea of independent statutory committee is very interesting because the role of the committee is to advise the Yang Tuan Agong whether the existing emergency will continue or not. So that will be
mm,
very interesting. But we hope that the opposition party members would also join and help, to decide the future of this emergency, even though it is designated until August 1st, 2021, but we will never know that it may be extended or even it may be shortened. So that the role of the temporary committee is very important. I mean, the role of the independent special committee is very important. Now, one significant provision which I think has also subject to a lot of discussion is the power given to the executive to acquire temporarily possession of land, building, or movable property. When we talk about pandemic before emergency, we heard about Akta 342 or Act 342, the prevention of infectious disease, control and prevention of infectious disease, 1988. Now that act also provide for the same power of requisitioning properties and building. Okay, but the provision of the Ordinance of 2021 has much more wider power because I would say that it gives the authority or the executive the power to acquire, of course, like the Acta 342, but in terms of compensations, there is a slightly different approach because compensations is paid, but in case of dispute, the dispute will be according to what the executive decide how to resolve the dispute. Unlike Act 342, which says that dispute has to be addressed or to be referred to the under the Arbitration Act. So that is slightly different approach to this issue. But I believe that the whole objective is to ensure that the taking temporary possession of buildings or land or whatever property is necessary to use for the purpose of the pandemic. We recently we heard about the government discussing with the or negotiating with the private hospitals. So of course the law, even law outside emergency can give the power to the government to ask the private hospital to help. But the emergency ordinance gives more powers to the government to even force the authority or the private hospitals to assist and to provide whatever assistance is necessary. Now, the other provision, which is I think should also be very interesting to look into, is the power of the army to be equivalent power of the police. So the army can arrest as a police officer. Okay. Then we have also some provision protecting the health professionals, the frontliners in the hospital, to be exempted from certain provision of the existing law. For example, the Medical Act, the Dentistry Act, the Pharmaceutical Act, and so on and so forth. So those requirements of the Act can be exempted because of the emergency. Then, of course, the debate has always been raging about why Parliament is not sitting. So we have provision in the ordinance which says that the executive authority of the federation remains with the existing government, with the existing cabinet and the prime minister, the state as well. But Parliament would not be sitting for the time being until the time is right to do so. So in fact, as a power is given to the Yang Tuan Agong to call Parliament sitting anytime when it is suitable to do so. It does not mean that Parliament would not be sitting at all, except that what is already been scheduled for 2021 for parliamentary sitting would not be effective in the right of the provision of the emergency ordinance. Okay, and of course, there is also a sort of a clause or clause which says that any law which is inconsistent or the ordinance which is inconsistent with the existing law, the ordinance will prevail. So this is definitely in line with what the Constitution has provided, that whatever laws made pursuant to an emergency declaration would may be inconsistent with any provision of the Constitution except for Article matters pertaining to religion, religion, language, citizenships, and also related to races, right? So this cannot be touched. But other than that, emergency ordinance that we have today may contravene any of the provision of the Constitution. But one thing that is important to note is that uh, even though ordinance made by the Yang-di-Pertuan Agong during emergency can contravene any of the provision of the constitutions, it does not mean that it can contravene immediately. You know, it has to be an express provision in the existing law, which is the ordinance, which says that it is inconsistent with the provision of the constitution. Otherwise, the existing provision of the constitution remains as it is. It applies unless an ordinance says that it will contravene. That is, I think we need to remember that, because as far as the law of the country is concerned, the constitution still applies unless an ordinance has been passed to override whatever provision in the constitution. So I will stop at this point, and I will continue later on. Thank you very much.
Okay, thank you very much, Prof. Nick. I think quite a number of important points that you have raised. I think, but the last point that you just mentioned, I think whatever provisions that provided by ordinance, I think we have the Ordinance 2021,
Yeah.
and if there are anything that contravenes or contrary to the provisions of the Constitution, I mean the government has to come up with a new ordinance, I suppose, to take over what's the provision that's stated in the Constitution. I think quite a number of questions that we can ask to you, Prof. Nick, on this matter, but I think we will reserve that. I personally also have few questions, but I think we will reserve it later. Okay, now we move to Prof. Dato' Adiba Kamarul Zaman. As we reach new daily cases in the four-digit numbers and our healthcare facilities on the verge of reaching its full capacity, what are your thoughts on the impact of the emergency ordinance on current health policies, including the MCO with its various levels of austerity? Yes, please, Prof. Adiba.
Assalamualaikum and good evening, everyone. And thank you as well for inviting me to be on this panel for this interesting discussion. Like Prof. Nick, I guess we're not going to be debating the rights or wrongs of the emergency, but what is important is now that we are in this emergency and the MCO, what we do with the time to ensure that it's maximized for the health benefits. Is the health system on the verge of collapse? And I think that was probably one of the impetus for declaring the emergency. And there's no doubt that compared to the first and second waves, we are seeing exponential increase in the number of cases. If you recall, in the first wave and in the second wave, the groups of people who were infected were quite distinct, and the clusters were quite clusters that hadn't spilled over into the general community. The difference that we have now is, in addition to those at-risk clusters like the factories and the foreign workers and the prisons, we are definitely seeing a lot of ongoing community infection where you can't link it back to those at-risk or high-risk occupations, etc. So the more we have this, the more people who are going to obviously get infected. And although some people argue, but the death rate is relatively low compared to even to the first and second wave compared to the disease. However, obviously as the proportion grows, the number of people who are going to fall into that category of high risk, where they are going to be at risk of getting severe disease, is going to be more. We know that at Hospital Sungai Buloh, and certainly at my own hospital, if in the first and second wave, the majority of people who were admitted were young, relatively asymptomatic, 60, 70, 80% had very mild symptoms. That proportion now has somewhat decreased, and we're seeing a lot more people who are sicker and needing ICU. So it is the concern, and the concern has always been right from the very beginning that lockdowns all over the world was to preserve the health system. So for me, what we need to do now that we're in this emergency, what I think we need to take this time is to really try and bring the numbers down, the number of infection, the incidence as we call it, as quickly as possible, so that we can get to a more manageable level. And how do we do that? We need to be much more aggressive than we are at the moment by doing more community testing, finding the cases and isolating them, so that we can bring the numbers down and keep it down. I think that should be our number one goal. It's very important now that we've declared the emergency and the MCO that we have an end game, because one thing we don't want to be doing is be in a lockdown forever, or even worse, we, of course, by locking people down, by having this MCO, you will see some reduction in cases. But if you don't have a plan after that, as soon as you open up, you're going to have the numbers again. So what? We're going to lock down again. So that cannot be the strategy. The strategy has to be very seriously try and bring the numbers down and keep it down, and look at where the problems are. And I think this is where some of the the legalities come into it. Two of the major drivers of the infection are, one, we know the foreign worker clusters, both documented and undocumented, right? And we need to have a much more comprehensive, holistic strategy to deal with this. It cannot just be testing. We must address the underlying problem of overcrowded accommodation. And I guess for those who are legally employed and have employers who can be asked to look into this, or who can be maybe asked is too gentle a word, who must be made to seriously address the problem of accommodation, and that's causing the risk for infection, is the undocumented migrants. And that's a much more serious problem, or difficult problem to deal with. And here, I think the punitive approach is not the way to go. And recently there was an announcement that we're going to look for them again and lock them up, and the first thing they're going to do is going to run away and hide and be nidus for infections again. So I think we should use this time to seriously look at the plans and the strategies in a much more, as I say, comprehensive, evidence-based, humane way of dealing with this very long-standing problems that COVID has just brought to the surface. And if we want to seriously deal with the pandemic, unfortunately, fortunately or unfortunately, we're going to have to make some of these tough decisions. The other area that we should use this time to make reforms is, of course, prison. 10% of the overall national infection, that was when I last checked a few months ago, arising from the prisons, from prisoners and the prison families and staff. Now, everybody knows about prison overcrowding. So what can we do with it? I believe, in talking to my lawyer friends, there are already provisions to release on license prisoners who are either nearing their sentence or are there for very minor offense. That would immediately reduce the number who are of overcrowding, and I believe it. there was a newspaper report from the Director General of Prison that close to 11,000 such prisoners have been identified. Now, so that's in terms of what we call decarcerating, and many countries around the world have done this because prisons have been a very hot spot for COVID all over the world. Now, the other is, so that can be immediately done. Then the other is, of course, to reduce the number of people going into prison in the first place. And again, I say we should take this opportunity during this emergency to do those kinds of reforms, of serious prison reform that will, in a way, kill many birds with one stone. If we're really serious about, first of all, controlling the pandemic, not just in the immediate stage right now to bring the numbers down quickly, but also in the mid to long term. Because as I said, we can, by stopping everyone from moving, through this MCO, we will to a certain extent bring it down. But as soon as you open up again, if you don't address these underlying chronic problems, we're going to face the issues all over again. Now, in terms of the provision that Prof. Nick mentioned about acquiring private hospitals and such, I know there's been a bit of a fight back from my private hospital colleagues. Yes, we need the help of our private hospital colleagues, and there are some private hospitals that are more than equipped to handle patients with COVID infection. But I think much more urgently is that we need their help to what we call decant patients from the public system, including the university systems, to the private health system to look after patients who are not infected with COVID. Cancer patients needing elective or semi-elective surgeries. And this is where we are facing problems, particularly hospitals like mine, which are hybrid hospitals. We still have to manage those patients who are coming in with heart attacks, with strokes, with whatever. And so if there is an arrangement with a private system that's more seamless, and where patients who come to either University Hospital, UMMC, or to HKL are those who can ill afford to go to private hospitals. Otherwise, they would have gone there in the first place. But there needs to be a mechanism of the compensation to the private hospitals. And then there are issues of insurance. So I think these are the kinds of hopefully legalities and policies that the emergency would look into. So maybe I'll leave it there, but I think we must not waste this MCO and this emergency, and really use this time to not just bring the numbers down, but really look into the underlying issues that's beyond health, that in fact do require legal and policy, that must be looked through the legal and policy lens if we don't want repeated MCOs and repeated lockdowns. Thank you.
Okay, thank you very much, Prof. Dr. Adiba. I think there are few questions that arise from your points, but I think your important point is how can we, I think the government, we the people, try to bring the numbers of this COVID-19 down. I think to compare to last year's numbers of cases and this year, perhaps that will be slightly, quite a number of increment of that cases. And what will be the plan for the government to take action on this after this MCO? And perhaps I think the public also like to know whether this MCO, or they don't think that we will have this MCO too for these 2 weeks. There will be an extension of this, so they are talking about it. And they have been saying that there will be no Chinese New Year this year. There will be no Raya like last year. That will be something that we need to, to observe that. Okay, thank you very much, Prof. Adiba. Now we move to Dr. Madeleine Burma. Okay, the question to you, Dr. Datuk Madeline. Since the outset of the pandemic in late 2019 and early 2020, the health economy dilemma has always been a tricky question for policymakers worldwide. How do you think the emergency will affect current efforts to balance between health and economy, especially in the short and long terms? Perhaps you may also touch a bit on the announcement made by the Prime Minister yesterday on this package of this, what we call it, the Permai package. Over to you, Dato Medrin, please.
Okay, thank you, Azam. Just call me Madeline. I'm fine with that. I'm still trying to. I'm struggling to get used to all these titles because I'm so used to get the 30 over years. My student just call me Dr. Mac, so I remember myself as Dr. Mac. But nevertheless, thank you very much to IAIS for inviting me to share this webinar with and I mean really distinguished guests. I posted on my Facebook. I considered it's such an honor, we with these three speakers here, Dr. Nick, Prof. Nick, Prof. Dr. Adiba. I've never been on the same panel with Dr. Adiba. We've met on different occasions, more of for social functions, and then of course Dr. Muhammad Azuddin. I always admire the work that he's doing. Okay, thank you very much. So basically, I would like to approach this discussion by presenting some graph for easy understanding because to me it is important rather than just me highlighting it. But let me just highlight, Dr. Adiba, I totally agree with the things that you say. We must go beyond health in order to address this pandemic. And in my case, I would want to go beyond economics so that we can understand that it needs a holistic kind of approach. Because you did mention about, prison reform. I am in Suhakam right now. We are struggling with that. With this request from the public, but I will go into that. Let me just share my slide. My name is, let me see. Let me see. Can you see? Can you see my slide? No?
Not yet.
Oops.
Not yet, Dr. Mukti.
Alamak. Ini yang I baru nak action kat you all ni. How to do that?
Okay, now it's coming, I think. Yeah.
It's coming, but I can't see it. Is it there?
There.
Yes. Now it's there. Yes.
Okay. Thank you very much. Okay. The state of emergency and the economy. So my task today is just to give an understanding of, is there really need for an emergency? People have been sending WhatsApp to me. Not that I am the Prime Minister. They think that I know a few things about the emergency and the economy. I will give my opinion. Although Prof. Azam just now said we cannot criticize the government. I'm not here to criticize the government. I'm here to just give my critical comments, whether there is a need and even if it is a critical comment, it is kritikan yang membina dengan tujuan untuk penambahbaikan. Okay. Now, I think most of us have seen people in economics almost every day. We will love to see what we call this graph. Let us just look at the graph up here first. I don't intend to go into the detail, but this is what Dr. Dato Adibah was saying just now, and also this is this very famous line. This is what we call. This is the capacity of our health facilities. If we go above this, meaning to say the COVID cases, there are more COVID cases and our ability to manage it. So this will be a problem. It will lead down to, this is the economic curve. It will lead to what we call a dip in our gross domestic product. It will lead to a dip in the economic growth. So there is a relationship between the higher you go, the lower this one goes down. Okay. So just for simplicity. So that's why it's very, very important for us to make sure bila the word landaikan kelok, to flatten the curve, what it means is to ensure that this curve goes down to this blue curve so that our capacity, our medical facilities, our medical capacity can manage. At the moment, I think you two did mention to the point that if we are not careful, we may reach a breaking point whereby we may be already here. whereby it is ready, where our medical infrastructure, medical facilities may not be able to cope with it anymore. That's why the importance of having the MCO. Now, the next question, do we really need an emergency? Now, that question, I think, Prof. Nick Kamal, you are the right person to answer. And later, maybe Prof. Azuddin. We in economics, we said, for me, I'm not speaking on behalf of the other economists. For me, for the time being, we may not necessarily need an emergency, because to us an emergency, we may need, okay, let's put it this way. Even if we need it, it is only for a very, very short time. That is to ensure that we can the emergency will bring about a flattening of this curve, and so that our economy can go back to its normal time. Okay, let's not go into this boring economic curve. Now, another thing that I would like to share with members here, so that we will understand where the situation, our economic situation right is. So 2019 in December, this is quarter 4, meaning to say at the end of between from maybe I think October, November, December, this is quarter 4. Our economy is really, if you can see that we are going down, negative. We in fact we had a negative 17.1% in terms of our, if you look at our gross domestic product. We economists look at this. Now, if we look at the curve, this is what we call the V-shaped curve. There are so many different types of curve. It can be a V shape, which is one of the things that we economists love to see, meaning to say it dips down and it goes up again immediately. That is something that we really hope for. What we may not want to have a kind of curve is the U curve. It goes down and then it goes flat and then slowly goes up. Another thing that we may experience is a W curve. It dips, it goes up a bit, and then it goes down again, and it goes up. But the most frightening of all is the L curve. It goes down and it never goes up. Now, in Malaysia, what the government is doing its best is to ensure we get a V curve, to get a sharp, although there is a sharp dip in our gross domestic product, but what we needed is actually to quickly make sure that the growth increase as fast as possible. Now, this is where the argument for an MCO, some people say we could have an MCO, it's already good enough. Why do we need an emergency? So that will be for other reasons. For the economists, an MCO has already brought this down, but an emergency properly proclamation, as we heard what the di-Pertuan Agong mentioned, it was basically to flatten the health the pandemic curve. Now, the kind of loss that experiencing during this period. Now, the highest percentage is in May last year, where our unemployment rate is one of the highest that we have ever experienced, 5.3%. Almost 1 million of our people were experiencing unemployment. Although we don't see these figures, but but it is slowly being reduced because you see these kind of figures are just like a doctor. I assume a medical doctor, when they see all this, on the screen where they say, it goes up. We economists also experience when we see this kind of curve. It is really frightening. You look at that, it goes up, but luckily it's slowly going down because if you know that. Even when the study was asked on the SMEs, what are the things that they experienced before MCO and after MCO? Many of them, if you notice the figure there, they were saying that there's a lot of there's a negative impact, and then areas of business most affected. So they call it cash flow and also sales. So you imagine with the total lockdown. So this is the thing that we really fear in economics. Total lockdown because of the need to flatten the health curve, the pandemic curve. On the other hand, it has really left an impact on the economy. So when Dr. Adibah said just now, we need to go beyond looking at all these things. So I totally agree. It is not just through lockdown. Similarly, in economics, I will let you know that I don't really I don't really think that we should use purely every time there is an increase in the number, we do a lockdown, and that is where the economic will be very much affected. And then what the government will do, they will come up with another fiscal injection. That they will come with. In fact, we have 5. This is the 5th one you expected me to discuss. I will do that in the second round later, the permai one. What are the things that I say, the good points, and some of the things that I expected. Okay, I have to move on. So the most people who are most affected are the golongan rentan, or what we call the vulnerable groups. Yeah, kanak-kanak, warga emas, that includes me, orang kurang upaya, HIV, mangsa bencana, and now not only bencana, we have bencana now. You know, with the what do you call it? With the banjir and everything, and also those affected by the shock. Some people in the T20, they lost their job. They are also very much affected. Orang asli, orang asal, and the fakir and daif. Kami orang Iban panggil dia orang ni, golongan ini merinsak. You know, you cannot even define them with poverty. They are called merinsak. That was the word. Okay, the last one I want to show is that these are the 4 stimulus packages that the government have put in place. Total 305 billion. Never in the history of Malaysia, the government has put up with so much to assist with this kind of a problem. Now we just had the 5th one, which is worth 15 billion. Now this brings to the next question. 1, do we need a lockdown? 2, do we need an emergency? 3, is it going to be another package? How many stimulus package do we need? Or do we need something else? As what Dr. Adiba, I really agree with her. This one I will discuss later. Okay, and if you look at the economic report, it says that last year punya economic report, they expected us to grow between 6.5% to 7% in 2021 after contracting about 4.5%. So the most important question now is that what kind of approach do we need? The kind of strategies do we need? Yes, all the kind of stimulus package that we had, including the one that has just been announced yesterday by the Yang Berhormat Perdana Menteri. It is a stimulus package that involves a kind of a hands out, short term. But what I am looking for is more of long term, that is sustainable, that empowers the community. Yeah. So I think with that, I will close my discussion. So I will wait for the next round to answer my discussion later. Thank you very much, Dr. Azam.
Okay, thank you very much, to Dr. Madeline. I think you raised quite a number of important points. I think from the economic perspective, we can see, I think, as you mentioned, the government has pumped quite a lot of these packages to help the economy. I think how much more that the government need to spend for this. And I think from the unemployment rate you raised, I mean, has reached almost 1 million, and now it is, I think, decreased a bit, if not mistaken, about 800 thousand unemployment rate now. I think that will be something which I think it will affect the country. And I agree with you. I think from the economic point of view, it's not good for the country, but I think maybe for the politicians, for if we were to talk about politics, there will be something good, I suppose, for both the MCO, especially for the emergency. Now we move to Professor Muhammad Azizuddin. I think this is quite interesting because he's from the we'll call it from this political science. Among the most apparent impact of the ordinance to our domestic politics is that we cannot have a fresh general election as well as other smaller elections up until August. This was done at the height of several party leaders publicly mulling for it in the near future. Hence, it has sparked polarized debates on the merits of maintaining a government that is slowly losing support or replacing it. What are your thoughts on the matter, especially in the overall context of fighting the COVID-19 pandemic? Over to you, Prof. Azizuddin.
Assalamualaikum, and also very good evening to Prof. Azam, and also thank you very much to IAIS for inviting me as one of the speakers for this forum. Yeah? And also, and first of all, I think I want to express gratitude as well to my fellow panelists because they already cover a lot of things, which also meaning that I don't need to cover and also to discuss touch a few things regarding health, even legal issue, and also economy. Yeah? And just now listening to Madeline mentioning about we have to go beyond health, beyond economy. I'm not sure whether we are going towards beyond politics in looking in the context of COVID-19. Yeah? But whatever happens actually is a political decision, yeah? In order to have a proclamation of the emergency. Yeah? And I think the first point I want to raise here, even though Professor mentioning about election, I won't go later about election. First thing I think regarding declaration or proclamation of emergency is not something new or rare, because it's happened everywhere in the world actually. In fact, for example, I'll give you some of the facts. In the case of United States, for example, out of 50 states in United States, that they have, 48 declare emergency in order to deal with the issue of COVID-19. So meaning that COVID-19 is a really big issue, and the recent country that declared for emergency is Lebanon. And I think you can see that and one country another probably I want to mention is like Romania, that they decided to delay their general election because of COVID-19. So in that case, COVID-19 is something very serious that the government and the people should deal with the issue. In fact, I think I remember even last year, I always reminded during interviews with the media, saying that we already managed to deal successfully the first wave. But as we know that the Spanish flu in 1918, if I'm not mistaken, that where the world faced 3 kind of wave of Spanish flu. So meaning that in the context of Malaysia right now, we already face the 3rd wave. I don't know how many waves that we have to deal, but this is something very serious. And when health issue become big global issues, also it will affect economy and also will affect political scenario as well. In not only in Malaysia, everywhere in the world. If you look in United States, for example, the crisis also contributed by the weaknesses of the government dealing with the issue of COVID-19. Okay, that's I think the first point. Because for me, declaration is not government can take something effort to declare emergency. And the most important thing is what's the justification of the government to declare emergencies. And this is create a debate right now with many section of the society. In fact, even the opposition also calling for what is the justification of the government. But for me personally, as academic, I think COVID-19 economic factor in the country already is a big issue, which I think require a government to give a full focus. The problem with right now in Malaysia is that this uncertainty in politics is so high. So where clash within the Perikatan National Government, and so together the challenge with the Kata Harapan government to the government as well makes the government's effort to focus more on politics rather than dealing with the issue of economy and also issue of health. That's why I think our region, our Agong, Agong, and also our Royal Council keep reminding people to be less politicking. So and also politicians as well, because now is not the time for us to fight each other, but we have to deal together to solve the issue of COVID-19 and also economic issue, which I think also very important to help our nation to be sustained during the COVID-19 period right now. Okay, that's the second point. The third point I think I want to raise is regarding election. I think you mentioned just now about election. As we know that we already declared two proclamation of emergency. One is in Batu Sapi, and another one with regard to Greek and also Bugaya by election. So meaning that that is the option that can be allowed to postpone the by elections. And as we know that I'm not sure, probably government also need to clarify on this, whether the decision to declare proclamation of emergency also because of to delay the election of actually the state election in Sarawak, which is scheduled to be held in June this year. So because the effect that we saw what happened in Sabah state election is very great, because it's contribute to the second also third wave of the COVID-19. So that probably give indication for our regions, our Agong, and so our government, that we need to declare emergency. Reluctantly, that you can see that at the first time when government proposed the idea to Agong and also Royal Council, they rejected the idea. But now they are accepted the idea, because we need to pool our resources, effort, all to deal with the issue of COVID-19. So I think in overall, many argue that through the Ordinance of Emergency 2021, there's a restriction of the role of Parliament, for example, and also a constitution as well. But for me, the opposition, even the government also can call for a special sitting of the Parliament if they want to discuss about issue of COVID-19 and economy. That's one thing. The second things, I think, the role of the opposition as well can still there, meaning that the check and balance still can be allowed, and also they can use many platforms actually, not only the Parliament, but now we have social media and also our media that can check and balance of the government. But the role of check and balance of the government should be there, because there's many accusations saying that because too much power given to executive, that there's a tendency towards dictatorship after this, which I doubt it would happen, because the proclamation of emergency right now is not a martial law. It's just a proclamation about health to deal with the issue of COVID-19. So it's very specific task to deal with the issue of health. So meaning that this is not like emergency happened in 1969, 13 May 1969. It's just emergency of health. So by having strong opposition right now, I think they can check and balance of the role of government and make sure that government don't go beyond the power given to them to deal with the issue. So I think in overall, even though I'm at the beginning, I'm a bit skeptical about the declaration of emergency, but so far what I see going on right now, I think probably that's going to be the best option right now to deal with the issue of COVID-19, because government can really pull off effort and resources, can also take over university if they want to deal with the issue of COVID-19. If suddenly the level of infection is so high, then they need buildings, for example, to assist the needs. Those who affected with with COVID-19. So I think that's all for the beginning. Probably in the second round, I think I will elaborate further on these issues. Thank you, Prof. Back to you.
Okay. Thank you very much, Prof. Azizuddin. It means that you are in favor to the emergency that we are experiencing right now. I think from the political science perspective, I think you have mentioned, for example, United States alone, from 48 out of 50 states have declared emergency, and I think it's also taking place in other countries as well. And of course, by delaying elections, the so-called general elections, also the by-elections, can give more concentration for the government to tackle this pandemic. And I think you have mentioned towards the end of your presentations, your point, that I think people talking about whether the present government have this, what we call, do they have this check and balance that in Malaysia by having this emergency. And you have mentioned without having parliaments sitting, I think Malaysia can also practice this, but it's all back to the Agong for that matter, as far as the matter is concerned. Okay, we are now moving to round two. We go back to Prof. Nick. How does this particular ordinance compare with other instances in our history where the state of emergency was invoked? Are there any significant similarities or differences? Prof. Nick, please.
Well, if you trace the history, we have, I think, since independence, we have gone through many emergencies, and many of these emergencies declared were basically focused emergency or specified emergency to specific area or states. 1966 was Sarawak because of the collapse of the civil governments. And 1969, of course, it was a national level emergency, a federal level emergency due to the racial riot. And of course, that was the biggest emergency since Merdeka. And then 1977, it was Kelantan, again, due to the collapse of the civil government. But uh, when Kelantan was declared, when emergency was declared in Kelantan, the 1969 emergency was still subsisting. And in fact, we were, in fact, two state emergencies, the 69, then at the federal level, 77 in Kelantan. And then 1997, due to the haze problems, I think there was a focused declaration of emergency. And then 2005 and 2013 also pursuant to the haze problems with to specific area. I think Kelang, Pelabuhan Kelang, Muar, Kuala Lumpur, Ledang, and of course 2020 last year we have the declaration of 3 emergencies for the purpose of postponing elections in mentioned by Prof. Aziz just now. Dewan Undangan Negeri Bugaya, Batu Sapi Parliament, and Gerik also Parliament, and of course recent emergency, national emergency 2021. So I mean that is already an indication of the reason for emergency is different one. There are different reasons for it. And if you were to compare 1969 emergency and today's emergency, you see the focus of 1969 was to deal with the racial riot, dealing with emergency that affects public safety and defense of the country. Okay, just to also note that before Merdeka there was already an emergency. Okay, 1948 due to the communist insurgency. But of course that was when we were under the British authority. All right, so 69 and 2021, totally two different reason for an emergency. So 69 was particularly focused on how to deal with this racial disharmony, how to deal with people on the street fighting each other. So law was passed, the Ordinance of 1969, the name is the same, Essential Powers Ordinance 1969, to deal with creating new offenses, to make it more stringent to punish people who are possessions of arms, possession of firearms, and also to deal with these offenses swiftly by providing special procedures to put them into jail or even to put them in the gallows for commissions of very serious offense. Okay, and of course, it gives power to the central government, the central authority, the executive, the Yang di-Pertuan Agong, the Prime Minister and the Cabinet was given power to make laws, to deal with all these, these urgent matters and to deal with them effectively. Okay, so, but the thing about 1969 emergency was immediately after general elections. Okay, and after that, before the sworn in of the Prime Minister and the Cabinet, there was an emergency declared. So it was a caretaker government until the situation was under control. Then only the civil government was able to actually go about and carry out their duties. Right, and after the establishment of civil government, the government went on to be established as an ordinary government where parliament was in session, general election was held because of the ability to control the situation or the danger or the insurgencies 1969. So you see that the unique thing about 1969 emergency was that the ordinary government came into play not long after the ability to control the insurgency. So as a result of that, until 2000, if I'm not mistaken, 2012, the 1969 emergency was revoked, and all laws passed pursuant to the 1969, 1977 was also revoked. So in that light, I think we are back into normal situation post 2012. All right. So if you were to look at the scenario today, 2021, and the provision of the ordinance that we have seen just now, that there's no parliament sitting, and election will not be called, and if there are vacancy in the seat, they will not be filled up. No election can be held, whether it is PRK or PRU for that matter. PRU, Sarawak would also be likely to be postponed in light of that. So I believe that the reason is justified in the sense that the need to deal with the pandemic is so overwhelming that the government needs to have more powers rather than just relying on ordinary law that we have. I think Dato' Adiba has already mentioned about the possibility of using this law that we have today, the ordinance, to deal with not just the pandemic, but to do measures that will help to reduce the pandemics. For example, I think that Adiba has mentioned about the possibility of releasing those who are already in prison to those who are already about to complete their sentence. So why not release them? Those who are to be sentenced to imprisonment would probably be sort of delayed and provide them with other measures or other punishment so that things can be better in the prison. That is one aspect. But of course, with the power that the government have under the ordinance, I believe there's so many things that government can do. For example, I can tell you that there's a provision in the ordinance of 2021 that gives the Yang Tuan Agong power to make regulation. Okay, regulations are quick laws over and above the ordinance to deal with specific issues. Okay, so all these measures that I think those who are the experts in dealing with the pandemics will be able to recommend to the government that how to deal with these measures effectively by providing regulations, okay, to specific issues, specific measures. Okay, so in that respect, I believe what we have today with the ordinance and all the powers that are given to the executive, it can be used for the goods of the society as a whole, and it's not just meant to sort of put into place things that are already in place. It's just, I think it's more than that. It requires, I think, the knowledge, the expertise of everyone in the country to help the government in this aspect. So this can be sort of, can be assisted by the law that the government can make immediately. I think that's the thing that we need to see during the emergency. Okay.
Okay, thank you very much, Prof. Nick. Okay.
Yes.
Yeah, I think you have stressed, I think, from the first round that this emergency is important for the country, and I think you have given I think this is not the first time that the country has experienced this circumstance. I think we have experienced it in the series of emergency. In fact, before Merdeka in 1948, and then with this 1966. I think perhaps the one that we are experiencing this year, 2021, would be very, very different from 1969 and the other emergencies. I think with that, I think your point that we need that ordinance of emergency for that matter. Now we move to Prof. Adiba. Okay, I think this is something that perhaps you have mentioned in the first round, but perhaps you may add some of the points. In your view, what are the most important steps that we should take to improve our domestic health situation? Over to you, Prof. Adiba.
Yes, certainly. And I think I want to once again stress that we must and we cannot waste this period of lockdown. As you've seen, the impact on the economy that Madeline has shown is really grave. So, we have to do things somewhat differently from before. And it worries me a little bit that, well, more than a little bit, it worries me that it would appear that the strategy now with the Ministry of Health is not so much to look for cases, and but instead to just manage people who are already symptomatic. Now, certainly from a clinical point of view, that's very important to diagnose people who have symptoms so that you can manage them clinically. But from a public health point of view, from what we understand about this virus, we must still continue to try and break the chain of transmission. We must still continue to try and flatten the curve. In other words, during this emergency, during this MCO, we shouldn't pull back on the testing and looking for active cases, but we should, in fact, intensify the finding of cases, testing, isolating them, because, and I repeat, we need to break the chain. We need to flatten the curve in all these cliches, and the reason for that is because to allow, of course, to allow the health systems to cope by breaking the chain, but also we just can't afford to have a runaway pandemic like what we've seen in the UK and the US. As good or as the NHS system is, they're at a breaking point. So we cannot allow ourselves to go to that point. And there are already warning signs about the new variant. This is a very clever virus. It's going to continue to mutate, and we don't know what else, how much more effective it's going to be. And the vaccine is going to be, sometime yet. So point number one, intensify testing, intensify, looking for cases so that we can break the chain. And how do we do that? We need to get, I know I've watched my colleagues in PKD, and my heart goes out to them, how hard they're working and how difficult the work is. We must move away from, of course, we must still continue to do the passive contact tracing, but what we need to do is to be better at using, technology to identify the hotspots where the clusters are. And in a way, we're already kind of trying to do this in Selangor, using digital analytics and identifying hotspots and target those mass testing in those areas. So we need to move towards digital technology and be much more precise with our testing efforts. So that's number one. Number two, you're going to say, but if you're going to go out and look for more cases, your hospitals are already at the point of collapse. How are we going to cope? Well, as I said, in actual fact, 80% of people are either asymptomatic or have very mild symptoms. And if we have a good system in place, they can be managed at home. Unfortunately, Ministry of Health is now starting to move towards that, but we need to move a lot more quickly in having, in allowing people to be managed and monitored at home. Again, using digital technology, as well as mobilizing our general practitioners to assist in home isolation. Of course, not everyone can be in those two categories can be managed at home. Those who can't, for whatever reasons, either they have big families living in a PPR flat or foreign workers who don't have a place to return to, that's doesn't have 10, 15 other people in the house. Of course, they can go to one of these government low-risk centers. But a large proportion of those who were in acute care hospitals can be managed at home. So that's another thing that we need to do, and we need to have a proper program to do this as fast as possible. And the third thing that I think that we need to do differently 12 months on from the pandemic is we must learn to work better together. We need to decentralize. Ministry of Health needs to work with private hospitals, need to work with teaching hospitals, need to work with NGOs. Now, if we're calling for the release of prisoners who are about to finish their sentence, where are they going to go, right? So the solution would be, part of the solution would be to mobilize NGOs who are already working in these kinds of areas to assist. Likewise, with the migrant workers, documented and undocumented. I don't know if we've done enough to educate non-English, non-Malay, non-Bahasa Chinese speaking non-citizens on the COVID pandemic, and the best way to do that would be to engage their own communities and bring them into it. I'm speaking this from the success of the HIV response to the HIV pandemic. One of the essence of the HIV response is to work with the community, and I think there are many things that we can learn from the HIV response that would be very applicable to the COVID pandemic, one of which is community engagement and mobilization of community workers. And then, of course, paying attention to things like inequality, and human rights, and all those basic principles, if applied to the COVID pandemic, inshallah, we'll see a change.
Okay, thank you very much, Prof. Adiba. I think you have pointed out these three important facts on this. I think perhaps the Ministry of Health, I think, should take seriously into your 3 points that you mentioned. I think the last point that you mentioned about that we must work together. The Ministry of Health must work together. Not only, I think, the public hospital must work together with the private hospital, with the NGOs, etc. So I think this is something that we should have planned it before, during the first wave of, if I can say that. I think we have been facing this. Not recently, it has been almost a year, and then I think we should sit down and make a proper plan for this. Okay, thank you very much, Prof. Adiba. Okay, now we move to the second round for the Datuk Madeline, if I can say. Are there examples or research from the global community that we can learn from in terms of balancing the impact of health and economy? Dr. Madeline? Can unmute, please?
I'm so sorry. My internet is really unstable right now. So maybe it goes with being a Saukian probably. So I'm not too sure. Okay. All right. If it happened to kind of break off, then you know what to do. You just get the next speaker, get from Dr. Muhammad Azudin to continue, because I'm really having problems with that. Okay. Uh, uh, there are two things that I would like to respond. The first one, just now, before I forget about remember you asked me about the permai, and later I will share in terms of trying to balance between health and economics. And in fact, in the context of Malaysia, although Prof. Azudin did not mention that, I would like to see, or rather look at it more as a triple kind of issues, crisis that we have to deal with. One is, of course, the health, then followed by economics, and on overlapped with that is our with politics. So it's really an interesting case study to be studied. If you really look in the context of Malaysia. Now, back to the question about Permai yesterday. Yeah, as I mentioned earlier, I look forward to the Permai, what do you call, the fifth stimulus package. But after a while, then I keep on asking myself, is there going to be another stimulus package? Number one. Number two, what is the amount? Okay, we already have, as I mentioned, the four packages was worth 305 billion, and the recent one, the Permai, is about 15 billion. So if we are going to have another more of these packages in the manner that it is being presented now, it's always about fiscal stimulus injection. That what about our, the ability of the government, because the ability of the government to finance all these. People are already asking First, I remember during the PH government, my whole life I've never heard about a $1 trillion thing. Suddenly, first time in my life, I said, how many zeros is there in $1 trillion? So we heard about our debt worth $1 trillion, and then suddenly it goes missing. I don't know what happened to it. And then suddenly now we are talking about billions of stimulus packages. I'm not saying that it is not there. It is real. It is very much part of the packages, and I see it there. As I said, it was estimated about 20% of our gross domestic product. One of the, I mean, if you look at countries across the world, people of the same level of development with Malaysia, we are one of those countries that really put a lot of emphasis in terms of trying to address that. So I must congratulate the government for doing this short-term approach. But how long can we do that? Eh? And that's where I really agree with Prof. Adiba when you say we must go beyond that. She even mentioned about this now human rights. So I really love you for that, Prof. Adiba. You know, there was I received not we I received a lot of hate messages immediately after, you know, when there was the lockdown, and there was the Rohingyas and the, what do you call it, when there was in the Selangor mention and everything, because we in Sohakam said they also had their rights. Oh, suddenly all Malaysians said, what do you mean? Why you talk about their rights? What about our rights as Malaysian? So you see, in situation like this, these are very, very sensitive issues. You know, in the past, Malaysians are very open to having foreigners in the midst of us. But suddenly now with the COVID and everything, Suhakam have in fact declared, not declared, we even issued press statements about xenophobia happening in our country in the midst among Malaysians, hate speeches. So I'm glad that Prof. Adiba, you brought this up today, and you're just before me. So thank you very much. So back to the issue of do we have experiences from other countries, the ability to balance? Okay, I'm not too sure about that, but what I can say is that when I look into the World Health Organization, you know, that's basically, and then the World Bank, the IMF, most of the time they are always trying to struggle with this idea of, first you must flatten the pandemic curve, then automatically to a certain extent it says that you will be able to address the short-term effect of the what do you call, the pandemic, in terms of mitigating the pandemic and how we can lower our economic slowdown. So the argument has always been you have to stop the pandemic. And the interesting thing, when we first started, we started by doing this lockdown because China was there was this logistic issue whereby in order for us to stop the pandemic, the only thing that we knew then, that was a year back, is by reducing what we call, we must stop, or rather we must practice social distancing, number one. Number two is to reduce the density of human beings and in one particular area. So that's why we stop in terms of production. You cannot go to office, you cannot go to your kilang or your industries to do your work, because that is where the high density of population is. On the other hand, we have to stop consumption, and that's why we cannot go to our mama store, we cannot do all the things. But to a large extent, it had left a very big dent in terms of our economic. So the government really was struggling with trying to balance that. So in the effort to balance this up, uh, then I was of the opinion that the what we call that, the politics suddenly come in. Then we heard about the pintu belakang, pintu depan, pintu istana, so many pintus. And then now, we heard from the proclamation by the Yan-Pertuan Agong. It is basically in terms of the objective is for COVID. So if you ask me, countries have struggled with it, trying to balance it up. But many countries, like many developed countries, what they normally do, they are going now into, one is, of course, I think this is where Dr. Adiba can give a better explanation. Now, with the vaccine coming in, now I am struggling. Why is it that Malaysia is a bit slow? Do I consider us slow, or are we being cautious, or are we being because I know that our neighbors are already and I don't know, can you say that they already inoculate what already prescribing that to their population or what. But we are still waiting until February, if I'm not mistaken. Yeah. So these are kind of issues. So the economists were saying we already have the vaccine. Why are we waiting here? Because to us, anything that can slow down the pace of the pandemic, so that is good for the economy. But on the other hand, we cannot put economy above and everything else, because at the end of the day, human lives are more valuable than the economic figures of, we are very worried about our ratings. People, the economists are worried, oh my goodness, our fish rating, we have gone down. Now we are at a different rating. Soon, Moody's rating will come out. And when rating goes down, what it means is that foreign investors start thinking, should we come to Malaysia? As it is now, we know that many of the big companies are already shifting the investment to our neighbors. I will not name which neighbors, but we are really now struggling with the idea um, that we are no longer the preferred destination for foreign investors. So this is what we call dah lah jatuh, ditimpa tangga, dah tangga tu, and then jatuh lagi, this flower pot again on our head. So as all of us have rightly mentioned, we need to protect ourselves, diri sendiri, our family, our community. We cannot rely too much on the government. There is a limitation to what the government can do. So my point, I always when I discuss this with my indigenous communities, we need to empower the people to take care of their own health, to empower themselves economically, to empower them so that they should not rely purely on the government, waiting for the government. Because in Malaysia, we have this policy of one size fits all. It's really like Panadol. You patah kaki pun dia bagi Panadol, you pening kepala pun Panadol. You just look at the education. You lock down everybody, education berhenti. And in fact, those people in the ulu areas of Sarawak, I don't even know whether they know such thing as COVID, pun kena lockdown, and they were asked, given to do, in terms of education, kena cari pokok to go and find the internet. Whereas some of them are, sekolah kurang murid, they can continue with their education system. But it's one size fits all. So I think I look forward to a new approach whereby the government should go more for boutique style lah. Bukanlah boutique mesti yang macam hotel, but it must meet the needs of the different people. This is where data is very important. Big data, internet of things. We need to know where are the poor, where are the vulnerable people, who are the one who are really in need, not having just a blanket statement for all. Okay, that's basically.
Okay.
May I chime in there? Because, these are things that I resonate very well with. Again, learning from the HIV epidemic, there is a mantra in the HIV world: know your epidemic and know your response. Meaning, we have to be looking at our data. Where are the infections, and target those infections, target those areas, not just in terms of localities and geographic, but also where are the clusters coming from. We need to do much better at being targeted, at being boutique, rather than this blanket response.
Yeah,
I completely agree.
Okay, thank you very much, Dr. Nadine. Also, I think some adding additional points by Prof. Adiba. I think as Dr. Nadine mentioned, I think we in Malaysia, I think it has been something that we experience. I think everything goes back to government. So because of that, when it comes to any matters arising, including what we are experiencing of this COVID-19 and the impact of it to the economy, I think largely the population goes back to the government. Of course, there are other options, but I think it's too little for that matter. I think if we go for Muslim, for example, I think we have the zakat. I think quite a number of portions of the zakat has been spending for this. I think it's not much, but at least something. And I think it is a very important point that you have raised, that I think we need to prepare our population to face this when it comes to this, what we call it, these difficulties of time, like what we're experiencing, that we can cope for that. I think that would be a good important point for that. Okay, we have the not the last question, but we have the Prof. Azizuddin on this. In your opinion, how do you weigh the pros and cons of having a state of emergency in the current climate of Malaysian politics? Prof. Azizuddin, please.
Yeah, thank you very much. Yeah, for me, like I mentioned to you, even though I'm skeptical in the beginning, but I kind of can accept, that we should have the emergency, in order to give a full focus to deal with the issue of COVID-19, because I don't think we can afford anymore MCO, because I think government already declared that by 22nd, almost all state will be under MCO except for Sarawak by 22nd of January. So I cannot imagine. It's difficult actually for the government to declare that, and also at the same time difficult for the people to deal with the MCO. When you cannot travel over district, for example, and also not only cross the border to other states, something like that, and also difficult also for you to have a lunch and dinner at the restaurant and everything, and also the business also will be affected greatly. I think probably Madeline will explain much better than me regarding this. So I think with regard to all these issues, all these concerns that we face right now regarding COVID-19, definitely emergency is the way. But of course, at the same time, we also need to empower, for example, the independence commissions that I think going to be set up. And I hope the opposition also will join the commissions, because the commission, I think, will look in details what's the emergencies, whether it can be prolonged or can be shortened, and I think if we deal it successfully within these 2 weeks, then I think it can be shortened, because there's an impact by declaring emergency. They definitely give a significant impact to our politics and also to our our economy globally, meaning that the investor, for example, at the beginning, I think you see that there's a perception saying that why we need to declare an emergency rather than why not we continue like MCO like before, because it's, but with the current data that we got, the increased number of infection, I think that's the best way to have emergency. But at the same time, so we need to empower, like I mentioned to you, the commission to check and balance, and so to decide what's best for the government, whether to prolong, also to shorten the emergency. But I think at the same time, when it comes to politics, the level of politics now, I think, a bit reduced compared to before. That's clearly we can see what's going on right now. So in fact, even though there's some views saying that criticizing the government, at the same time as well, criticizing the opposition because of too much politicking and everything. But at least I think focus already there, and people talking about people. I think people already going through the MCO, the first MCO, and also the other, since last year, which I think people know already how to deal with COVID-19. The only thing is, probably they also need more information from the government, from the health ministry, in order to deal with the issues. And also with regard to vaccine, for example, I think raised by Madeline also, Pradiba, because we have, for example, like me, probably I know, I listen to world news regarding vaccine, but for the point of view of people on the ground, probably they know nothing about vaccine. So, and they keep asking when they can receive it, and also when government can bring, because we have to import vaccine from abroad and come to the countries, and whether this is responsible of the federal government or responsible of the state government, because as we know that Selangor state government decided to buy, to purchase vaccine for their own populations. Is that also other state like state of Kedah, my state here, in UM, also have to do something similar to this. So meaning that there's so many still uncertainty in terms of policy and clarity. What next to do, and so what the best to deal with the issue. And for me, MCO is so tough to the local population. That's why I think we can afford to have MCO anymore, but we try to find the best way, best option in order to reduce the number of infections among the population. Because we actually, this I think like Prof. Adiba saying that this is very clever, virus, and even though we have information about this, but still also we have difficulties without the help of the government. So in that way, I think hopefully by having emergency darurat, so meaning that we can really give really focus to help the population, help the people, and at the same time so people can gain more understanding and knowledge about the virus, and so vaccine, everything, and together we can reduce the number and hopefully to eradicate fully COVID-19 in Malaysia. At the same time, so dealing with the issue of economy another issue which I think so concerning and so affected people greatly in the country. So I think that's all from me. Pass back to you, Fazam.
Okay, thank you very much, Prof. Azizuddin. I think you have been repeating your points that we need this emergency for the survival of this, what we call it, to put down this wave of this politics in Malaysia, in particular during this COVID-19 pandemic. I think for those viewers who are watching us, you may post your questions if you are watching through FB Live, you can post it in the comments, or those who are on the Zoom, you may ask questions directly, perhaps. So we now open to Q&A, and I have a few questions here. One is from Brother Sayuti. Perhaps this question addressed to, I think we can open to everyone, but I suppose the points would be for Prof. Nick as well as Prof. Azizuddin. As among the main reason behind the proclamation of the emergency governance is to prevent the general election amidst the pandemic. Do we have any other alternative to delay general election without resorting to emergency ordinance, or is it the one and the only choice that we have? Perhaps Prof. Nick and also Prof. Azizuddin can respond, or maybe
okay.
other panelists as well. Okay. Yes,
There
Prof.
is
Nick.
also a question in the Zoom Q&A there. Question, I think, about what does, for example, grave emergency should cover. I think Article 150 made it very clear that grave emergency, if the Agong is satisfied, if the Yang Tuan Agong is satisfied that grave emergency exists, where the economic life, the safety, and also public order are affected, then I mean, emergency may be declared. Now, the issue of pandemic is, does it falls under any of these categories or not? I mean, that's a question. That's a question. If you are a law student, then you're probably looking at Stephen Kalomingkan decided by the Privy Council, where the Privy Council had defined, in fact, and expand the meaning of emergency to include also pandemic or endemic, And in that respect, it's already answered the question of people who raise this question whether COVID-19 falls under the category of safety or economic law or public order. Okay, so that would definitely be something very clear and very objective. And in fact, when we talk about if the Yang di-Pertuan Agong is satisfied, then it is the Yang di-Pertuan Agong who actually decides whether emergency should be declared or not. And the government is there to propose and suggest, but it is the final say of the Yang di-Pertuan Agong. So, of course, there were this argument that there were cases in the past decided by the Federal Court, the Supreme Court, also the Privy Council, that the Yang di-Pertuan Agong acted on the advice of the Cabinet and the Prime Minister. But of course, you see, the interpretation of that can change. Okay, but going to the question just now that Dr. Azam was asking, whether is there any other way of dealing with, with parliamentary sitting or parliamentary elections other than declaring emergency. Now you see the provision of Articles 54 and 55 are quite strict. I mean, if there is a vacancy in any seat, it has to be filled up within 60 days after it's been notified by the Speaker of the Dewan or the Speaker of the Dewan Undangan Negeri. Okay, so that's very strict provision. So there's no other way that you can stop the organization of organizing an election if there is a vacancy. Similarly, if the life of Parliament has reached the 5-year period, then it has to be election. It has to be a dissolution of Parliament, either automatically or by the declaration by the Yang di-Pertuan Agong. Then election has to be held within 60 days. So in that respect, Sarawak election would have to be held in June, because that is the period where the life of Sarawak Dewan Undangan Negeri will end. So therefore, it has to be held. But so if emergency is declared, then emergency ordinance can be passed to delay or postpone. That's what happened in Batu Sapi, in Gerik and other places. Okay, so that's the reason why government will have to, the government will have to recommend to the Yang di-Pertuan Agong to declare a state of emergency. Thank you.
I just want to add some point, Razam. Okay, I just want to add. Hopefully, you can listen to me. Regarding whether, of course, I think the only way to stop or to delay the election is only by declaring of emergency. But I think if we want to continue to have elections, yes, I think for those who promote democracy, everything, probably we want to see election to be held, even though during the pandemic period. But the problem is that there's a big risk to have election during this pandemic, because like I mentioned to you, like I mentioned earlier, Romania, for example, decided to postpone their elections. So, and also we already see what happened in Sabah, which I think the spread of COVID-19 happened in Sarawak, and also because of people who traveled there and so came back to Peninsula, then they spread the virus in the Peninsula as well because of that election. And another example is in United States, for example, during the presidential election, even though there's a suggestion earlier to delay as well the presidential election, but because there's many resistance among member of Congress that continue, they need the election to be continued in order to decide who's become the next president, because the terms is there. The terms are already fixed, then they have to have the elections. So that's why we already see that what happened last November, Joe Biden won the election. But back to the issue of parliamentary election, for example, we still have mandate until 2023. So I think why we need to see the the elections earlier, because the mandate is still there. Because the mandate is determined by the people, because people that voted for member of parliament. Actually, people not really voted for the government, but the people voted for the member of parliament. People of parliament that decided what government to be formed. So that's the reality of Malaysian politics right now. So because the mandate is there, so I don't think with the current situation is conducive enough to have election early. Unless if there is the term is end already, like in the case of Sarawak, yes, the term will end in June. So because of that, I think the only option that we have is to declare to have a proclamation of emergency. So I think that's some addition I want to add regarding this.
Professor, if I may jump in again, I know I'm splitting hairs here a bit, but from a public health point of view, I think the election itself, in terms of voting, measures can be taken to make it safe. Like extended days for voting, the postal votes, and so forth. where the concern is in the campaigning, you know, and the Malaysian style of campaigning of ceramas and mass gatherings. So that is going to be very difficult to control in Malaysia, I think. So the voting itself, I think we could look at different ways of doing it, but trying to tell people in Kelantan not to go for house-to-house campaigning is going to be near impossible, and stopping the mass gathering, which is where what COVID likes.
Okay, thank you, Prof. But I think there's a point that I want to raise to Prof. Azizuddin. You mentioned that if you were to refer to the mandate by the people, and that's all from the constitutional points of view, I think the next general election, or we call it PRU 15, will only take place sometimes in 2023. But what is now, we are talking about politics, what is now taking place just before, I think just couple of days before this emergency was declared, that there were that's not rumors, but there were talking, or there are, I mean, incidents by these politicians, by some MPs, that they withdraw their support to the present government. So do you think that we need to wait until 2023, or just after this I mean, this emergency ends, this MCO ends, or within this MCO, and then we can have the elections? What do you think of that?
Okay, I think there's a many ways to see on this this issue. I know there's a proposal coming from UMNO, for example, submitted to support Anwar Ibrahim as a prime minister, and submitted already to Agong regarding this. But I think there's a before that, you can see that there are many many voting in the parliament, where you can see that the government always defeated the opposition in many votes. So I think if they want to defeat the current government, I think that the best way is in the parliament. So I know there's still the big issue whether the vote of no confidence or vote of confidence can be tabled in parliament. I think that's within the parliament jurisdiction that can explain on that issues. But I think because of previous case, you can see that government always won the voting, and even though there's an attempt later on, several member of parliament to declare not supporting the current prime minister. But I think I'm not sure whether that's because the reason why we declare emergency. But I think if we look on this issue separately, actually the bigger issue that the government have to deal, even if there's a new government later on, established, they also have to deal with COVID-19, which the number increasing. So, which I think for the people on the ground, because I'm also people, and also looking at people on the ground, they already fed up with the politicking among politicians. In fact, they ask actually politicians to be take care of their people on their constituencies rather than keep politicking, determining who's be in government or not, everything. So because people are already concerned about their economy first, actually. Health, of course, but economy first, because so many people, young people, they lost jobs, everything. So they want a stable government that can help them by reducing the number of reducing the politicking among politicians. I think it can help give a focus to government to deal with issue of health and also economy. Okay, another point that I want to raise as well, whether election is the best option. There's a debate as well among people, whether the best option that can ensure the stability in the government, meaning that is to establish a stable government in Malaysia. That also can raise a lot of questions, because you can see now the current, we used to have Barisan Nasional as a coalition government, but crumbled. Now Barisan Nasional is not only 3 party left in the Barisan Nasional. And also at the same time, in Pakatan Harapan, they also have leadership problem and also difficulties in the parties. Then we have Perikatan Nasional forming just as a marriage of convenience in order to establish a government to replace Pakatan Harapan government, which are rejected by them, also by the people. So in that case, you can see that there's no real stability in the coalition government or coalition parties in Malaysia, which I don't think by having election also can bring stability in the government. So while we are facing with the bigger issue now, COVID-19 and also economy, why not we focus on this issue, dealing with issue, then later on we decide. That's why I think by proclamation of emergency until 1st of August, if we able to deal with the issue of COVID-19 economy, then I think we can go with the earlier election after the end of emergency. I think that's probably the good way of thinking that, okay, now we are focused on two big issues, then later on we deal with the issue of politics. So I think that's probably the reason behind the proclamation of emergency.
Okay, thank you very much, Prof. Azizuddin. Okay, we have a question from Prof. Adiba. Beyond policy, beyond ordinance, beyond politics, what are the specific that can be recommended to the government from medical perspective? Is there a channel to contribute such expert opinion? Do you think a COVID-19 expert panel need to be established as a form of royal commission to ultimately handle this pandemic?
Yes, I
Yes.
think the short answer is yes, and I think I alluded to earlier that what we need is a really, working together. This is a complex problem, and that's beyond, as I kept stressing, this is beyond health. Although obviously health plays a central part, and I was one of the signatories to that open letter to the Prime Minister, and one of the points that we made was the formation of a multi-sectoral task force to deal with it. Take, for instance, the issue of schools. The when to open, when to close, when to close schools need a specific working group just to debate these issues on schools and universities that must bring together people from health, teachers, parents, and get people's viewpoints so that we come up. Of course, the public health people will need to set the matrix and the criteria for opening schools. But there are still many things that can be done because I think it's super important to let our children continue to go to school. It's beyond just the classes, but it's that social interaction that that's very important for school children. I think we don't have time, but there are many things that can be done, for instance, that takes advantage of our climate. We've not talked about the importance of climate, of the importance of ventilation that hasn't been spoken about enough in terms of sort of the mid to long term ways in which we can learn to live with the virus. The schools, for instance, open the doors, open the windows, have fans, have classes outside. But these things require people who are actually dealing with it to see what the problems are, what the solutions are. So again, it cannot just be a pure top-down decree to deal with this. So that's why specific working groups, whether it's for factories, whether it's for construction, industries, schools, universities, etc., need to be formed. And I believe this is in the process of being formed.
Okay, thank you very much, Prof. Adiba. This question, the question that I just asked you is from Joseph Lee, and he also asked a question to Dr. Madeline. Number of cases is inversely correlated with GDP. That is true at any part of the world. Now, besides stimulus grant that is bound to go to the drain, what are the best approach to increase our GDP, such as new way of doing business, product innovation, shift towards human capital development? A big question mark for that. Dr. Medri, unmute please.
Can,
Okay.
okay, yeah. What was the last part of the question? I can't really hear. Is it about human capital development,
Yes, yes, yes,
Azam?
yes. Human capital development. Yes,
Okay, yeah. Thank you very. Yes, thank you very much. Yeah. If you notice that a big chunk of our stimulus packages is about how to, number one, there are three objectives, main objectives. Yeah? Number one is, of course, to address the survival of our people, in terms of livelihood, to ensure that livelihood, food on the table. So that was the main intention, the first one. The second one is basically for businesses, to ensure businesses, the survival of the businesses. And the third one is basically for economy in the long term. Now, if we look at all these packages, the economic or stimulus packages, it is basically to address the economic side of it. And economics has always been associated with one is that gross domestic product, like it was mentioned now, it was inversely correlated. Now, another element that was, I think towards the end, Prof. Adibah did mention about education just now. I am really concerned because I come from a state. I come from Sarawak. I've known of my relatives. I've known of my, people from my longhouses whose children are very much affected by the COVID, not only in terms of health, but also in terms of their human capital development. Yeah. Okay. This is where what we have been talking about is what we call the lost learning generation. It is one whole year. In the year 2020, imagine the whole year of 2020. I was envisioning when Tun Mahathir first announced, Vision 2020. I was imagining that we are going to fly, what Malaysia was going to be like, because I was just a student then. I was in the university when we were asked to imagine what is Vision 2020. I could, at that time, I cannot imagine that this is what is happening to us, that we are almost like one step forward, two step backwards. The things that we have achieved so far, suddenly because of the COVID and because of things that are happening in our country. I'm also talking about governance. We must not forget the issue of COVID is one level. There is issue of integrity, governance, corruption, which has been plaguing our nation. So it kind of, all interrelated. Now, coming back to what you call this now, when you talk about human capital development, when we talk about human capital, there are two big elements involved here. Number one is education. Number two is skill. And of course, number three, there is now to the third level is what we call health. So these three interrelated factors, COVID-19 has really, really affected these three elements of human capital development. Number one, education, as I said, the lost learning generation. I really hope that we are not just thinking about whether when to open the school, when to close the school, how many hours, like the recent announcement whether our children should start going to school on the 21st, 20 whatever it is, or it should go after that. This kind of policy decisions that are not consistent. Parents were angry, and then we heard today NUTP was saying people accusing teachers of makan gaji buta. We should go beyond all this. I think our nation, we need to work together and how we can address the problem faced by our children, the lost learning generation. Government need to invest a lot in that, not just repairing sekolah-sekolah daif. Don't talk about sekolah daif in Sarawak. It is really a big issue. Now we need about infrastructure. We need about face-to-face learning. Now, and people were talking about technology. People in Sarawak, they don't really. We are too obsessed with high-end technology. We forgot that they are technologies that the people, simple things as simple as TVs. Simple things like radio, television, Malaysia. We can still use those facilities and it works in the rural areas. So why are we worried about them not accessing 4Gs or 5Gs or whatever and asking them to go and climb trees in order for them to sit for exam? Of course, you don't ask them to climb trees, but in order for them to have access. Whereas you can still use cyclo styling machine. And I do respect a lot of the teachers in the rural areas are doing their best, to meet all these things. That's why we cannot have a one size fits all. Now, another element of the human capital development, beside education, is skill development. We talk about TVET. What is happening to our TVET? What is happening to skill development in our country? It has long been neglected. We are too focused on the academic that we forget that there is the other side to it. Now then we realize that our communities, our students, our universities, we should not just focus purely on academic achievement, how many A's that they are going to achieve, but also in terms of skill development. And the third element is, of course, health. So that these three things, I think, for the next level of government policies, although these have been discussed in the budget, but I think for the next, or rather for the future, in terms of if there is a need for the government to introduce another package, bantuan or whatever. I think these are the new elements that I would like to be seen or to be included in the government's new packages, not just uh, fiscal or not just monetary policies or fiscal policies alone, but incentive for human capital development and empowering our community. To me, empowering is very, very important because we have so long forgotten about the role of the community in addressing problems on their own, because we are too much, as I mentioned. Now I'm reiterating that we are too dependent on the government. I think one of the countries that where the population, almost everything we depend on the government. The government will tell you have to do everything, but then after that we blame the government if we were given the wrong prescription. So why don't we play a more important role? So I think the universities have an important role to play, NGOs, the communities, the public sector, of course, and then the private sector. These four helix, very important collaboration between the four. Thank you very much. I pass
Okay,
to you
thank
now.
you very much, Dr. Medlin. I think perhaps with the remaining times, we can only take one question, and the last question. Perhaps this question is addressed to both Prof. Nick and also Prof. Azizuddin. We have a number of emergency declaration based on need analysis appropriate to the time and season. Would you agree that this declaration is akin hitting two birds with one stone, maintain political stability, and to have a united focus on handling COVID-19? That an unstable government make it hard to fight this virus? Perhaps Prof. Nick can start first and then followed by Prof. Azizuddin.
Well, to me, I see it as a very unfortunate situation that I think the present government is facing. At the time when the pandemic was raging, and at the same time there was also some problems with majority supports for the government of the day. So in that respect, whatever that the government of the day is doing would be, would be translated or would be interpreted in not just single definition. Is defined in two ways, that like what you have mentioned just now, and the question that you have raised is, I think this is very unfortunate, but I believe that, I mean, for whatever worth that the government is doing, I think uh, the government has come to a situation where they have to make a decisions, and this decision is to request for the request the Yang Agong to declare a state of emergency, and whatever perception that come after that will have to be dealt with in a way that would help the government to be sort of making a good decision at the end of the day. I think so. In that respect, whatever you look at it, whatever way that you look at it, what we are facing now is a real thing. I think that Dr. Adiba has really explained clearly, and so that would then give the government what we call that as a decision to be made. So that decision has to be made, and it was made that this pandemic will have to be dealt with by an emergency law, and so whatever the perception that comes after that will have to be dealt with by the government, and they will have to do it in a way that will not affect their focus on dealing with the economic problem as well as dealing with the pandemic problems. That's my view. Thank you.
Okay, thank you, Prof. Nick. Prof. Azizuddin, please.
Yeah, I agree with Prof. Nick, which is, I think, yes, now is a very opportunate time for us, not only us. I think it's issue is very global issues, and government need to be, meaning that we need to have a stable government, which I think we don't have since last year when we have a change the government. So that's why, in the context of this, decision already made, meaning that we proclamation of the emergency is needed in order to give a focus, give a full focus of all effort, all policy, and also all resources that we have to deal with the issue. So I think, one good thing that I can see from the emergency is that there's a time frame. That's, I think, is a good thing. Unlike before, which when I think we abolished the emergency ordinance somewhere, I think in 2011, if I'm not mistaken, which is, I think, it started already the emergency when we declare emergency in 1969. So that's why I think the laws such as the Ordinance Secret Act was there before, later on being abolished by Najib Razak when he was a prime minister. But this time, I think, is more clearer. Focus on the health and more clearer in terms of timeline and the power given to the government, and also and the function of the government also mentioned there, even though there's a limitation in the role of the parliament. But I think everything is put together in order to deal with the issue of COVID-19 and also the economy as well. So in that sense, I think let's see what's happened. And I think we as a people also have our role to be critical of the government as well. If government, where we can see government probably go beyond the power given to them under the Ministry of Ordinance. So I think people have their duty as well to check and balance the government, and of course opposition also have their role to make everything in order together with the government to deal with the issue of COVID-19 and also economy. So I think that's all from me, Razam.
Okay, thank you very much, Prof. Azizuddin. I think we are approaching the end of our program today. But before we end, perhaps I would like to give the opportunity of every panelist to have a last few words. We can start with Prof. Adiba, please.
Okay, so this current MCO and by extension, I guess, emergency is, as we all have heard, is costing us a great deal economically and psychosocially. So, I think it's up to all of us to ensure that we make full use of this, and firstly, I guess, try and bring the numbers down as quickly as possible. And as Madeline keeps saying, it's not just up to the government, it's also up to all of us. I think we know what we have to do, but also beyond those who are not in a position to social distance and all that, there are other structural things that need to be done. I've spoken about them in, for instance, the migrant workers, the prisons and all that. So it's going to take a huge effort from everyone, but most importantly, I think the government needs to come up with a clear national plan that involves, the federal government, but also decentralizing to the state as well as the district level to empower down to the district level and below, and have a real. I mean, the multi-sectoral involvement and all of society response cannot just remain a slogan. It really has to be operationalized.
Okay, thank you, Prof. Adiba. Dr. Medlin, please.
Okay. Thank you very much, IAIS, for organizing this very important webinar. I only like to point out 2 points. Number one, I strongly believe that we Malaysians must work together because we have to live with this. Because many of us think that once the vaccine is there, then there will be no more COVID. I think after reading through all the international journals and research on this COVID thing, I think we have to admit, or rather, I have to admit to the fact that we have to live with this COVID for at least for some time. Dr. Adiba, I don't think that it will go from our life at least in the next 1 year. So we have to live with it economically, from politics, from everything. So as Malaysians, we need to work together. We because I don't have any more. I don't have any other place to go. I only have Malaysia and Sarawak for that matter. So this is the place that I'm born. This is the place that I'm going to live, and this is the place where I'm going to die. So I want it to be the place where each and every one of us will do our best to make Malaysia a better place to live in, with or without COVID. Thank you.
Okay, thank you very much, Dr. Medlin. Prof. Azizuddin.
Uh, yeah, I think it's very good webinar where we can share our thoughts regarding the issues. And I think the best way for us is to come together as United Malaysian dealing with the issue, and for politicians, I think it's also good to reduce a little bit politicking in the current situation, because I think why not we pull our effort focusing on one issue, health issue, and also economic issue, another one, which is very important. Then I think politics can be, can be reduced a little bit during this period until we find way to deal with the issue, and we can go back after the emergency, in looking of the what next in our future when it comes to politics. But right now, I think give focus and also our attention to deal with the more concerning issue like COVID-19. I think that's the best way.
Okay, thank you very much, Prof. Azizuddin. And last but not least, Prof. Nick, please.
Well, I believe that emergency has its own advantages, and of course, we talk about disadvantages a lot. There's a lot of criticisms about emergencies, but I believe that in the light of the situation today, pandemic that we are facing with now, I think law can be used either as an instrument to punish, but at the same time also as an instrument that can also help to make things better. So in other words, law can be used constructively. With that power that government have today, I believe that government should be working on trying to find ways to use law to help to reduce the incidence of in pandemic. I think which I think we have discussed that about a possible change to the law to improve the situations rather than just to punish people for not observing the SOP and observing the MCO. That's my view. Thank you.
Okay, thank you very much, all the panelists. I think we are very delighted to have all of you here, as well as viewers from FB Live, as well as from Zoom. We would like to thank everyone for participating in this important forum. Has been a very fascinating discussions, and I think, as what we have been discussed, I think by the panelists, I think now the emergency ordinance are in place. We have to live with it until I think the longest, perhaps 1st of August, the 2021. And I think on many occasions, all the panelists have agreed that we cannot leave it only to the government to handle this case. All of us have to work together to give help to solve these problems. It's not only in the hands of the government. With that, I would like to thank Prof. Nick Ahmad Kamal, Dr. Madeline Burma, Prof. Adiba Kamruzaman, and Prof. Azizuddin for spending your time tonight to discuss with this matter. And I think we hope that Allah subhanahu wa ta'ala help us, protect us. Thank you very much, everyone. Good night. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Bye bye.